This recording will go over the end of the PowerPoint practice questions for chapters 26 and 37. We'll start with the burn chapter, chapter 26. Please pause the video to read the scenarios and to think about your own answer, and then resume the video to hear if you're correct. For this first case study question, the correct answer is: the priority concern with this patient is the airway. An emergency assessment should be first completed. The productive carbonaceous sputum with labored breathing and singed hair is a sign of inhaled exposure and smoke inhalation. Knowledge of the circumstances causing the burn is valuable in the management of the burn victim. Continuous airway assessment is a nursing priority. The emergency physician will be there to assist the nurse during this critical period. A full assessment should be performed after the initial emergency assessment is completed. For this question, the correct answers are A, B, and D. For this question, the correct answer is B as in boy. For question 1, the correct answer is B as in boy. For question 2, the correct answer is B as in boy. For question number 3, the correct answer is D as in dog. Now we've moved on to the end of the PowerPoint questions for chapter 37, care of patients with shock. Again, go ahead and pause the video to read the scenarios and think of your own answers before resuming to hear if you're correct. The correct answer for this question is: when the patient's elevated temperature is reported by the nursing assistant, it is the nurse's responsibility to determine what action should be taken. The nurse should proceed to his room to perform a complete assessment. The answer to this question is: the development of infection should be considered based on the patient's operative history and vital signs. He has tachycardia and increased respirations, as well as a moderate amount of purulent drainage at the abdominal dressing site. Surgical dressings should not contain purulent drainage. The correct answer for this question is C, B as in boy, D as in dog, A. Based on the findings, the patient is possibly developing sepsis. The wound should be cultured immediately, and the nurse should notify the lab that blood cultures must be obtained. All cultures must be drawn before administering the antibiotics. The first anti-infective should be started within 1 hour after the blood and wound cultures are obtained. The nurse may then give the patient Tylenol for his fever. The correct answer for this question is B. The correct answer for this question is: the patient is going into severe sepsis. The main manifestations are low oxygen saturation, rapid respiratory rate, decreased to absent urine output, and changes in cognition. He is at risk for septic shock. The blood oozing around his IV catheters may indicate the presence of DIC. The correct answer to this question is B as in boy. The correct answer to this question is B as in boy. The correct answer to this question is D as in dog.